The doctor is in, and we're happy to welcome back Dr. Brandon King from Montereau to discuss the issue of hospice care. It's a topic no one wants to face, but is becoming more common as parents and loved ones age. Today, we're focusing specifically on the role caregivers play. So I know a lot of people probably, know it could happen eventually, have a lot of questions about it, but don't really address it until it's time,
Sure.
right?
Yeah.
So what's kind of some of the key points they want people to know about?
So, we've talked about some of it on the segment. One of the main things is just, a lot of people feel like there's somebody that's in the home the whole time. But usually what we have is we have a nurse that will come out, either an RN case manager, maybe an LPN, and they'll come out and see the patient 1 to 3 times a week, depending on the need and the particular phase in the disease process that they're at. We'll also have an aide that'll come out, provide care, things like activities of daily living, bathing, cooking, cleaning, if whatever needs that are there. We also have chaplain services, so for bereavement, end of life. We talked about the chaplain, but also social worker. So there's different things that that can come into play, and funeral services arrangements, and the social worker can really help with that. And then we have some volunteer services that fill in the gap whenever for whatever else may be needed.
Is there any training for caregivers specifically to know how to deal with this as caregivers?
Yeah, what we do is we have the nurses that will come out, and we really work to have them train. We encourage that every time we talk to them. We want to train. We want to make sure that they're training the caregiver, because a lot of times the caregiver, since we're not able to be there 24/7, the caregiver can be a family member, a friend. If we're fortunate enough, you can have an agency that'll come out and provide that care. But each time, the medication, just administering the medicine, sometimes we have where we use some sublingual medicines where it's just under the tongue. And so sometimes it can be hard, it can be uncomfortable. I mean, you may not be used to administering medications. So if we can train with that each and every time, training on, how to prevent pressure ulcers and different things that we see in end of life, if we can train the caregiver, then they're much more able to provide the care, and it takes a little bit of discomfort or a little bit of worry away from them if they understand how to actually provide that care.
Now, what if the caregiver maybe gets overwhelmed or needs a break or something like that? What should they do?
Sure. Yeah, caregiver burnout is real, and so we just want to make sure that the family member doesn't feel like they don't feel guilty about that, because they're the psychosocial stressors of just trying to figure out what to do to take care of them and how to do that. Maybe even if you have an Alzheimer's patient, they're up at night, and then so you're sleeping with one eye open, and so needing the assistance for that. And even just self-care for that person in general. So there's a thing called respite care. It's a single 5-day duration where you can put the loved one or the person you're caring for in some sort of facility with 24-hour care, maybe a hospital, maybe a long-term care facility. And so it just gives you that period of respite where you can take care of the things that you need. It's just like whenever we are on an airplane. If you have kids, you know that when the masks come down, they tell you to put the oxygen on yourself. If you don't have oxygen, you can't take care of yourself. You're not very good at taking care of your kids. Same thing with hospice. That's what respite care is. You can do that once every recertification period. That's either 2 to 3 months, depending on what stage in the care that you're at.
Important topics. I mean, I think a lot of people have a lot of questions about hospice, but don't really know who to ask or when to ask before it's, they have to deal with it. Thank you so much, Dr. King. We appreciate you being here.